Hello everyone. So today we are here with the X-rays of a patient who presented to surgical emergency with history of roadside accident with blunt trauma chest. So we have the first X-ray and we have one second X-ray. So first X-ray is before intervention and second X-ray is after intervention. So in X-ray 1, what we can see, there is a huge pneumothorax on the right side, and due to which there is collapse of right lung. Besides, there is deviation of mediastinum towards the left side. We can appreciate tracheal deviation to the left side, and there is deviation or displacement of diaphragm downwards on the right side, so which is suggestive of huge pneumothorax, that is most likely a tension pneumothorax. Okay, besides, the second question is what is the diagnosis. So diagnosis is tension pneumothorax. So what basically is tension pneumothorax? So basically there is one way valve. So there is one way valve and the air enters into thoracic cavity either through the lung, which is injured, or through the chest wall because of penetration in the chest wall. Okay, so third question is what are the clinical features you suspect in this patient. So basically he is a patient of tension pneumothorax. So in tension pneumothorax usually there are bizarre symptoms. So what we can appreciate, there is dyspnea, there is tachypnea, there is distended neck veins as you see in case of pericardial tamponade. Then there can be tracheal shift also clinically, which can be appreciated, but this is a delayed sign. Okay, then there will be hyperresonance on the side of tension pneumothorax. There will be absent or decreased breath sounds on auscultation on the side of the tension pneumothorax. Now, how do you manage this tension pneumothorax? So first let us discuss what can be the causes of this tension pneumothorax. So it can be because of penetrating injury. So as there is one way valve, the air enters through the opening in the chest wall. And second, it can be because of blunt trauma chest along with parenchymal injury. So again there will be air leak into the thoracic cavity. And then third, there can be iatrogenic injury to the lung parenchyma. So it can be because of some biopsy, then because of the central venous catheter insertion. So this can also because be and then one more thing, it can be because of air leak. So if air leak is not managed properly, so there will be tension pneumothorax. And then last is mechanical positive pressure ventilation, which can also causes tension pneumothorax. Now what are the management? So management is basically immediate decompression. Okay, so historically what they used to say that so you have to do immediate decompression in second intercostal space in mid clavicular line using a needle. So that is needle thoracostomy. But nowadays the current teaching is that so you have to do that needle thoracostomy in triangle of safety. Now what is the triangle of safety? Triangle of safety is the triangle which is bounded posteriorly by the latissimus dorsi, anteriorly by the lateral border of pectoralis major, and then there is a line passing through the this nipple. So now the fifth question is what can you appreciate in this X-ray 2? So in this X-ray, basically this is a post-intervention X-ray of the same patient of tension pneumothorax. So comparing this with the first X-ray, what we can see here on the right side, there is complete inflation of the right lung. The pneumothorax is gone. The diaphragm is upwards as compared to the X-ray 1 in which diaphragm was pushed downward. The mediastinum is centrally placed. It is not deviated to the left side. Beside trachea is centrally placed. So in addition to this, what we can appreciate here, we can see surgical emphysema in the right chest wall and in bilateral neck. So then there is a chest tube in the right thoracic cavity also, and then we can see there is endotracheal tube also in the trachea. So that means the patient is intubated. So besides, there is a fracture of the right clavicle and fracture of bilateral scapula, which is also visible in this X-ray. Okay, so finally this is a post procedure X-ray of tension pneumothorax.